am Chan Hou from Department of Urology, Shanghai Jiaotong University affiliated 6th People's Hospital and Shanghai Eastern Institute of Urologic Reconstruction. Today, I will show our study with you. The title is, How are anterior urethral strictures diagnosed and treated in China? An internet-based survey. Records of urethral stricture diseases can be traced back to ancient times. Although it is one of the oldest urological diseases, we still have poor understanding of this disease. Among various types of urethral strictures, anterior urethral strictures are most common, accounting for more than 90%. In order to learn the current diagnosis and treatment of anterior urethral strictures among urology, street in China, and explore the differences with developed countries and anterior urethral strictures guidelines. We carried out this study, looking forward to providing valuable suggestions for its diagnosis and treatment. Based on the prior surveys, we designed a questionnaire suitable for Chinese urologists by referring to relevant literature, consulting the experts in the field of urethral reconstruction. The survey consisted of respondent demographics, preoperative evaluation, surgery-related experience, and postoperative management. Next, we sent it to the general urologist via Wedget, the most popular social media software in China, in a network link. It was conducted from March 19, 2020 to April 10, 2020, and lasted 2 weeks, using descriptive and multiple correspondence analysis to analyze the data. 1,267 valid questionnaires were obtained. The survey involved urologists in all 31 provinces and municipalities of mainland China. The most common age group of respondents was between 30 to 39 years old. Attending urologists and associate chief urologists comprised the majority. A majority of urologists worked in grade A tertiary hospitals, while 408 urologists worked in secondary hospitals or those inferior to secondary hospitals. Of all respondents, 53.2% of urologists stated that they had participated in training. 3% of respondents stated that they had not performed urethroplasties. The majority of respondents had performed less than 5 urethroplasties in the prior year, with only 8 performing more than 10 cases. Diagnostic methods of anterior urethral stricture is diverse. UrethrographY and urocystoscopy were the most commonly used, which is similar with prior surveys in the AUA guidelines. UrethrographY was the most common diagnostic method reported in the survey, which was higher than has been reported in other countries, including the Netherlands, Turkey, and Italy. The percentage of urologists utilizing urethroescopy was similar to what has been reported in prior studies. Compared with the Netherlands and Turkey, the utilization rate of urolometry was low. Urethral dilation and internal ureterotomy were the main treatment procedures. End-to-end urethroplasty was the most commonly used open surgery, followed by skin flap urethroplasty and free graft urethroplasty. They were preferred to choose buccal mucosa to perform urethroplasty, which is consistent with the recommendations of the guidelines. While Chinese urologists most commonly used urethral dilation, previous studies have shown a tendency to use IU. Cold knife was the most used method for IU. Only about 1/5 of respondents followed the AUA guideline. The maximum suitable length for IU is less than 2 cm, which was higher than in developed countries, such as the Netherlands, Germany, and Italy. Survey 76. 2% of urologists insisted on using urethroplasty only after the failure of minimally invasive surgery. 23.8% thought that urethroplasty should be performed at the first, if the indication was appropriate, which was almost identical to the rates in Germany, Italy, the Netherlands, and the USA. Survey results found that the treatment of Hou in China is still dominated by minimally invasive surgery. The majority of urologists insisted on using reconstructive bladder strategy. In general, compared with developed countries, the overall diagnosis and treatment strategy of Hou are similar, and there is still some gaps with the AUA guidelines.